How to understand your TB IGRA test results. Have you ever wondered what your TB Interferon-Gamma Release Assay test results really mean? This blood test is designed to detect infection with Mycobacterium tuberculosis, the bacteria that cause tuberculosis. Understanding your IGRA test results can help you make sense of your health status regarding tuberculosis. There are two common types of IGRA tests: QuantiFERON-TB Gold Plus and T-SPOT.TB. The results from QuantiFERON-TB Gold Plus are reported as positive, negative, or indeterminate. T-SPOT.TB results can be positive, borderline, negative, or invalid. While these tests provide qualitative results, they may also include quantitative data showing how much interferon gamma your immune system released in response to TB-specific antigens. However, interpreting these numbers alone can be tricky, as specific clinical guidance is limited. When you receive a positive result, it suggests that you likely have a TB infection, whether latent or active. This means your immune system recognized the TB antigens and produced interferon gamma. To confirm whether you have latent TB infection, which is not contagious, or active TB disease, which can be spread to others, further tests like chest X-rays and clinical evaluations are necessary. On the other hand, a negative result generally indicates that you are unlikely to have a TB infection. However, it is important to note that a negative result does not completely rule out the possibility of TB, especially if you have symptoms or if you are at high risk, such as being immunocompromised. In these cases, it is wise to interpret negative results with caution and consider additional diagnostic tests. Sometimes, you might receive an indeterminate, borderline, or invalid result. This means the test did not provide clear information. Such results can occur due to technical issues, immune suppression, or improper blood handling. If this happens, retesting or using alternative tests like the tuberculin skin test may be necessary. Understanding the controls in the test is also crucial. The nil control measures the baseline level of interferon gamma without any stimulation, and values should be low. The mitogen control is a positive control that ensures your immune system can respond appropriately. A positive response to the mitogen confirms that the test is valid. The TB antigen response is calculated by subtracting the nil value from the antigen-stimulated interferon gamma level. A positive test usually requires this difference to exceed a specific threshold. A positive IGRA indicates a TB infection but does not differentiate between latent and active TB disease. Additional clinical evaluation, including symptom assessment and chest imaging, is essential to determine your disease status. Conversely, while a negative IGRA generally means no TB infection, it does not completely exclude active TB, particularly in symptomatic individuals or those with weakened immune systems. It is important to remember that IGRA tests are not perfect. They can yield false negatives or indeterminate results, especially in young children or immunocompromised patients. In such cases, repeating the test or using complementary tests may be necessary. Routine use of both IGRA and skin tests is not generally recommended unless specific clinical situations justify it. In summary, understanding your TB IGRA test results involves knowing whether your test is positive, negative, or indeterminate. A positive result suggests a likely TB infection, while a negative result reduces the likelihood of infection but does not rule it out entirely in high-risk or symptomatic individuals. Always consult healthcare professionals for a comprehensive evaluation based on your IGRA results and clinical findings.